one of the folks we've been working with for a few years now is an extraordinary person who's comes out of Australia, was raised in Australia, and did his actual medical training in Australia, MBBS out of Australia, came to the U.S. and boarded up as a U.S. physician at Columbia University, and then did his residency at New York Hospital in child psychiatry. And today he has just an extraordinary passion and an extraordinary amount of knowledge around child psychiatry, around, again, looking at adolescent and pre-adolescent anxiety and depression and suicide and things like that. And part of what his mission to do is to really help reduce not only the anxiety and depression, but also the suicide rates that we're seeing within kids, particularly 5 to 12-year-olds. And Victor, welcome to the program. And again, thank you for joining us today. How are you?
I'm good. Thank you very much. And thank you for inviting me, Stan. And I actually sort of graduated as an American doctor before an Australian doctor, because in those days they offered you the opportunity to do your sort of American exams, because they told you this is the smartest you're ever going to be in your life and you better do them right now. And so I was able to do the exams that they were offering. I sort of graduated and passed, and I sort of was a bit more of an American even before I knew it. But now I've been here for 50 years. So.
No, it's fantastic. So again, I think really what we want to do is, as we're talking about digital and as we're talking about JP Morgan and CES, which you've obviously been to both, you understand them both. But we also want to offer a personal side to what those conferences provide and give people a better understanding of what's going on within the ecosystem, and leaders like yourself in the digital health ecosystem that have been working nonstop for years to try to improve healthcare through digital platforming. But to start that conversation, would love to hear a little bit more about your journey, particularly like what was it like going to med school in Australia in the 80s, and how was that as someone who now sees the globe and you've been all over health systems all over the world?
It's you graduate when you're young there. They sort of look at you when you're a teenager at high school, and then they give you tests and they determine what sort of profession you should be in. And so they slot you in that particular way, and they did those things for me, and I was put into the medical group, and then there were like 300 of us, and then they sort of look at the numbers and they chop off about 110, and so I became a candidate, and then I entered the medical school world. And in those days, you learn a lot of practical things as a medical student. You do surgery and babies and all the wonderful things that you need to do when you become specialized. But in those days, you were thrown into the pot, and so you learn a lot. So in a practical way, we come out with a lot of muscles, that sort of thing. And so, and in Australia, I had the opportunity of going to 2 schools there. One was in Queensland, which was more of a tropical part of Australia, and the other one was in Melbourne, which has more of a sophisticated, I use that word, education. And I graduated in 1967. I can talk more about that if you like. And then I came to Canada for a couple of years, and then was invited to be part of Columbia University. So not Columbia, New York Hospital, which is now Cornell. Or that was Cornell in those days as well. And so I went and did my adult training there. Now, did I answer the question, or did you want me to just?
Yeah, this is great. Well, I think I'd love to get your perspective too, because I mean, everyone hears about New York City and what a rough city it is, whatever.
Oh,
You came to New York City in the early 80s as an Australian. You'd never been out of Australia, and all of a sudden you're in New York City, and now you're seeing like this rough and tumble city of the 80s when Times Square was a red light district and it was crazy. Tell everyone a little bit about, like, you land in JFK, you get off the plane, and you go to Washington Heights, of all places, in New York City for you're getting boarded up in the U.S. as a doctor. What was that like?
Well, if I just go back to like being an Australian or an Aussie, and then having that lifestyle there, which is sort of a British lifestyle, and outdoors and running, and you're in in Queensland, you're like in the jungle basically, and then incessant blue skies and beaches and a lot of physical activity, and and sort of being free in that particular way. And then seeing myself in New York City, which is a completely different environment. So the child in me, because I am a child psychiatrist, the child in me like saw the world completely differently. You know, all of a sudden, it's not exactly what I was raised with. This is from the child point of view, right? There's a conflict there. And how do you adjust from one environment to another? Fortunately, I was a doctor and I was able to use my head. And so I was able to sort of ameliorate some of the issues that were going on. But in those days, New York was like some part of it was demilitarized, basically, where I was. And so that was an amazing experience. But, you're young and you fit in and you know how to dress properly and you know how to sort of fit into the community and you start to adapt. Um, I'm going to bring one issue about the difference between Australia and this is my prejudice here, and it sort of does raise issues about the journey I've taken since then. Is that the America has a completely different way of looking at things than other countries, especially in Australia, and so you come into America and especially to New York with sort of a need to balance both of them. And so I'm sensitive to the way people adapt to their environments. And it became pretty critically important to me when I saw it in kids. And I can see the conflicts that were going on, and I could see how they were able to adapt and not adapt. And so I was intrigued by that, and I think that was sort of a driver, like a bias driver almost, if you like, for me to be involved with kids and their journeys. And it was easy for me to identify with kids and to see their anxiety and depression and see which ones worked and also see the ones that didn't work. And being an adult psychiatrist as well, you sort of know the consequences of what happens when you're a child. You can see what happens at that end. So the training I got here was very complex and also very good because I saw beginning and end. And that's the way I see what I do now. And I see how valuable it is to focus on the children as our asset here. And
Absolutely. You're 1,000% right on that. And I think everyone in the audience would agree with you and just absolutely throw so much respect your way. And that's, I think, a lot of what we saw at CES and JP Morgan is that a lot of people are paying more attention to what's happening within the certainly the pediatric populations, the adolescent populations, but definitely that 5 through 12-year-old age population. We're seeing a lot of new technologies and a lot of things come together there. And child psychiatry was what you focused on when you were training at Columbia, when you were doing a residency at New York Hospital. Talk to everyone a little bit about what you've seen. I mean, particularly over the last year, suicide rate for children all-time high in the U.S. after growing slowly over the last 9 years. And again, for the audience, that if this is new to you, we'll cover more of this next month in terms of these statistics. But it's been growing over the last 9 years, the childhood suicide rate in the United States. It's unbelievable. And last year was at all-time high. So I think we're seeing something really deteriorating rapidly. We need to do something about it quickly. And again, I should call you Dr. Talbot because you're a physician, but Dr. Talbot, from your perspective, what are some of the issues there that you're seeing, and what are some of the causal root issues that you're seeing around suicide and for 5 to 12-year-olds in the U.S.?
Yes, and I sort of see suicide as a sort of it affects every age bracket, and it's becoming more alarming here when you look at statistics in the younger kids, because whoever thought that like 10 years or 12 or 13-year-olds would be involved with suicide? We see it as older, and so it's becoming more a common language. You can actually say the word. You could say cancer 50 years ago. And so it's on the table. And just from my experiences of going to the events, the medical events, 2 years ago when I talked about it, it was very uncomfortable. People didn't want to hear me talk about it. But the last year, they don't mind. In fact, some of them are actually comfortable talking about it. And I was sort of weirdly embraced, because there was a way for me to introduce the topic. So I think in the last year, maybe my impression, that it's become an easier thing to look at. And I can quote you statistics that will make you feel very uncomfortable. I'll just do one, that every 11 minutes someone kills themselves here. Every 11 minutes, if it's not a normal suicide, it's sort of an overdose, which is like suicide-like, and that's 11 minutes as well. And so it's like a plane crash every day, 135 people getting on a plane every day, taking off from here to wherever you want to go for an hour, and the plane crashing and everybody dying. And so that's sort of the reality of it. And we don't want to hear it, basically, you know. And so my point of view is here, and I look at statistics that 50% of all suicides, they attribute it to this age bracket that I'm involved with. I'm selecting 5 to 12-year-olds. And this is sort of world I sort of know about, you know, and this is where I've treated as a child psychiatrist. And I know that brain there at that 5 to 12, pardon me, kids, but I'm using it as a brain here, that it's malleable. And so it takes in lots of things. And you can take in bad things and you can take in good things. And what I brought in was a sort of a patented product that doesn't talk, that's completely movement and entertainment based, because I also come from the entertainment world and play therapy is entertainment. And so I was able to sort of bring in a whole other type of experience for kids through the modern world of animation, the modern world of digitalizing animation, the modern world of looking at kids' bodies through animation and volumetric capture, and the way of looking at a child's complete world, basically.
And that I think that's spot on too, because that's exactly what we're looking at. When we look at these things, they have to be holistic and they have to be enriched and they have to be very visually appealing, going to a lot of the neurotech stuff that we're studying as well. So Dr. Talbot, again, thank you for joining us today. We're looking forward to seeing you again soon, certainly February, and we'll catch up with you later. Take care.
Thanks so much. Thanks for inviting me. Thank you, Stan.